My name is Cynthia Harding, and I'm the Maternal, Child, and Adolescent Health Director for Los Angeles County. And I want to tell a story about infant mortality in a particular community in Los Angeles County and how CityMatCH helped us to deal with that problem. Los Angeles County, like many counties throughout the nation, we have an infant mortality rate of about 5 infant deaths per 1,000 live births. And our infant mortality among African Americans is almost double that, a tragedy that we face in this nation. In this case, I was minding my business at my desk, and I got a phone call from a community advocate, very anxious. "You didn't tell me!" I said, "What? What's happening?" Apparently, our department had released a report about infant mortality in particular regions in our county. And the infant mortality in the Antelope Valley was double that of the entire county, so 10 babies dying per 1,000 live births. And in particular, of extreme concern was that African American babies were dying at almost 6 times the rate of any place else in the county. Pretty soon the phone was ringing off the hook. The Board of Supervisors was calling me. "What are you going to do to fix this?" We had reporters calling us. "What are you going to do to fix this?" We had community members calling us. "What are you going to do to fix this?" And it was crazy. So one of my first things was this reminded me of an exercise when we had a team that went to CityMatCH and did a Data Use Academy. Thought, I'm going to call CityMatCH and see if they can give me some guidance and some help about this. Got on the phone and said, "Do you know anybody else in the country who's had to deal with this? Because I'm freaking out here. I've got everybody saying, how are you going to fix this?" They said, "Yes, we do, as a matter of fact," and they linked me with Carol Brady from Jacksonville, Florida. And Carol Brady had faced a similar situation. She said, "Let me tell you about some of the products CityMatCH has that you can use that'll help you to address this." She said, "Most importantly, they're going to help you change the focus of this problem from what are you going to do to fix this to what are we all going to do to fix this." Let me turn it to Margaret to talk about some of the tools we used.
And I'm Margaret Chow. I work for Maternal Child Adolescent Health Program, Los Angeles County. And first, we use the perinatal period of risk, PPOR. The training we learned from CityMatCH. PPOR is a very powerful data tool. It provides a framework for us to perform data analysis. From PPOR, we're able to identify areas which had the highest infant mortality rates. And also PPOR led us to develop another tool we called LA Mommies and Babies Survey from LAM Survey. And LAM Survey helped us to identify factors associated with bad birth outcome. From our LAM data, we found almost 40% of African American mom who recently delivered in an infant experienced discrimination in their life.
Hi, I'm Angel Hobson. I'm the Fetal and Infant Health Coordinator for Los Angeles County in Maternal, Child, and Adolescent Health. And after finding the numbers that you just heard from Margaret, we heard from CityMatCH that they were putting out an application to become one of 6 national organizations to address African American infant mortality and undoing racism, and trying to understand, looking at all of the national organizations, how racism contributes to birth outcomes. And working with CityMatCH, we were invited to Memphis to participate in an organization who does trainings on racism and undoing racism called the People's Institute. We came to Memphis and we were in a room with about 50, maybe 60 other people, learning a lot about each other and other ethnicities and how the multiracial issues around racism and the stress that we deal with during pregnancy, how it impacts the birth outcomes. CityMatCH sponsored this. It was a national effort, and we were able to be one of Los Angeles, Colorado, Memphis, Wisconsin, Chicago. We are all come together to look at those issues. One of the things that we have learned and been able to do since we've become part of this national effort, is to do trainings for healthcare providers. And we're very proud of the work that we're doing in Los Angeles County. We have done one large training for healthcare providers where over 100 healthcare providers attended, who were dealing with the issues of cultural competency, literacy, patient-centered care, attitudes around their patients and their biases. And out of that training, all of the providers agreed that they had increased their knowledge around racism and that they would refer their partners and their colleagues to this training. We've done several trainings within our own organization for the People's Institute, and our Healthy Start partner has trained 5 directors and 300 of their staff through the People's Institute. So we feel like we're gaining traction in this area, and we're looking forward to the challenge that we have ahead of us. Thank you so much, CityMatCH, for introducing us.
CityMatCH had our back, provided us with support and the tools we needed to improve the work we do at the local level.